I think this is going to be a wonderful session with Dr. Kavanaugh. I would like to introduce her before she starts her presentation. It's lovely to have you, and let me just read her bio so that you will all know who she is. So Dr. Kavanaugh is a licensed clinical social worker and associate professor in social work at the Helen Bader School of Social Welfare, University of Wisconsin-Milwaukee. Dr. Kavanaugh was previously Dr. Kavanaugh was previously a social worker at the HDSA Center of Excellence at Washington University in St. Louis, which informed her applied research on children and youth in families living with neurological diseases. Dr. Kavanaugh is a leading expert in young carers and is the principal investigator for numerous research studies addressing Huntington disease and ALS and Alzheimer's and other related dementias. She's received funding from the National Institute of Health, the Administration on Community Living, Substance Abuse and Mental Health Service Administration. She has developed interventions for young carers in the US and South Africa, including Y-Care, an evidence-based youth caregiving skill and support protocol for youth in families with neurological disorders. Additionally, she is an author of 5 books for youth, family, and social school professionals, supporting youth and families with ALS. She has presented her work both nationally and internationally on youth, families, and end of life in neurological disorders. So you have a lot of experience, and we thank you for being here. So you can go right ahead and begin your presentation now.
Thank you so much, Helen. It's always so bizarre just sitting here and listening to someone talk about you.
Right.
I'm so very grateful. And I want to say for those of you on the call, why we started a few minutes late was I messed up our time zone. So I'm an hour off. And so I apologize for that if that made this meeting a little bit late. But I am so very, very, very thrilled to be here. I was so excited to be asked by your chapter to come and talk about this topic, which I have spent a very large portion of my life and my professional career working in. So again, I thank you so very much. Next slide, please. So thank you. So talking about ALS, something that I want to make sure we kind of ground ourselves in, because if there are any families on the call, this is where I just want to be really clear that this is a topic that is incredibly difficult, that is emotional, that can be very painful, and can be very unclear. What do you say? How do you say it? When do you say it? And I wanted to start this conversation with saying that, you might feel scared, you might feel helpless. You might feel like that you don't really need this talk because your kids are doing fine, but you also might feel like ALS should not be discussed in the family or in the home. And the truth is that all of these things are very normal, that families and even professionals working in ALS struggle with how do we think about, how do we talk about, how do we engage our children and our youth around ALS? There's no definitive answers. There's no one way to do it. There's no one book. There's no one experience. But I want to make sure that everybody knows that this is all very normal, that our feelings are up, down, positive, negative. And as we launch into this presentation, I just want to reach out and provide support and let you all know that anything I provide here in this talk is, yes, based on my research, based on my clinical expertise, but it's also suggestions, because anytime it comes to your children or children in your home or your grandchildren, you know them best. So I hope you take this presentation as a support, as a guide, as just something to really put in your tool belt as you figure out how to navigate life with ALS. Next slide, please. So, why is this presentation happening? Well, ALS is definitely a family experience. I've had so many families over the years tell me that ALS is a disease of the family, and that families as a whole need a tremendous amount of support, and that ALS doesn't come with a handbook. But one thing that we do know definitively is that the children and the youth and families with ALS, they definitely receive less attention than the adults. And that's often because we as adults, we as professionals, and we as family members just aren't really sure what to say or how to say it. Next slide. So, what I'm going to be basing this conversation on is the first book that I wrote about children and youth and families and ALS. And certainly, the Greater New York chapter has copies of it. It can facilitate getting copies for you. But I'm going to use this as a basis for a lot of the conversation in this presentation. So, please do reach out and ask for copies. It's available online in a PDF version. You can certainly get a printed version, but the primary tenets in this presentation are in this guide. Next slide. So, how many people and families are out there who have children who are living with someone who have ALS? And the thing is that it's very, very difficult to track, primarily because a lot of the assumption around ALS is that it's older adults. But there are lots of grandchildren in those families. So, multiple years ago, myself and my colleagues, beginning with my colleagues in the Wisconsin chapter and really engaging chapters across the country, did a study where we interviewed 100 families, and two-thirds of them had a youth in the home. And we asked them, can we talk to this child in the home about the experience of living with ALS, about maybe helping to provide care with someone who is living with ALS? And many of the parents said not only were they concerned about having us interview their child, but they said, you know what, we really haven't even discussed ALS with our child. So we're a little uncomfortable about having someone else do it. Next slide. So, why is it that parents struggle with ALS? Not the least of which is it that you've maybe just been diagnosed, or perhaps it's progressed to the point where things have become more difficult, or some of your activities of daily living have changed. But the key tenets that the parents have told us are that they don't want the child, their grandchild, to have to think about it. And that they also feel like the child or their grandchild is just too young, kind of regardless of the age, really. But most importantly, and most common, the parents in the study told us, I don't know what to say. I really do not know what to say. And that is the cornerstone of not only the book that I referenced a moment ago, but really the cornerstone of this webinar, in that how do parents know what to say, and what can we as professionals do? So, next slide. So when we ask the youth, what do you want to know? And what do you want to talk to your parent? And what does it feel like to talk to them? They say they really want to talk to their family member. They want good communication. They want to have a conversation. So we have parents who are absolutely understandably struggling with this, which makes perfect sense. But then we have children and youth who are saying, but I'd really like to talk about it. So, what we need to do is be able to find that sweet spot in between to support parents to say, it's okay. It's okay to talk about this topic. And for children to say, it's okay to ask. And it's okay that you're not going to offend your parent or your family member by asking about ALS. Next slide, please. So, I'm sure quite a few of you are saying, okay, that's all good and well, but how do I talk to my child? Because there's one thing that parents say to me all the time is, I feel like it's a stop and start. Like I think about it and then I get really nervous and I don't know what to say, or I get emotional. And the biggest thing I can tell you is to at least start the conversation. And throughout this talk, I'm going to mention conversation, talking, probably a million times, because even if it's something that feels very stilted and it feels very awkward, or maybe it feels very emotional, having that conversation is critical, because not talking is what can build up the anxiety and the worry and the fear in your child. So think about the times when you're doing things that are very normal, watching TV, having dinner, whatever it is that is your normal time, and bring it up then. It doesn't have to be the big talk. You don't have to turn off the TV and really focus. But if you integrate it into normal everyday tasks, activities, then the child, your child or your youth will model that, and they'll realize that it's not the big bad conversation, it's just part of your normal everyday life. And this can be tough to kind of acclimate to, because you might still be worrying about, I shouldn't say this or I shouldn't say that. So I hope you can take the should and shouldn'ts and put them off to the side and just think about how I can have a conversation with my child about this thing called ALS in our life. And the key is to be honest and to start with basic information. You don't have to jump all the way to the farthest end, and seek out experts. And these experts can be the ALS Association. They can be your physician. They can be your child's school staff who really understand how to engage children. They can be a lot of different people. So we encourage you, don't feel like you have to do this by yourself. Reach out, and particularly the ALS Association, the chapters across the country, not the least of which the Greater New York chapter, but all of the chapters have amazing personnel, many of whom I know well, and they are very well equipped to be able to support you and talk to you and help you through this process. But in the end, you do know your child best, and you don't have to cram everything into one conversation. Next slide, please. So people ask a lot, so how do we talk about this, based on age? And maybe I have a 5-year-old and a 15-year-old. How do I have that conversation with both of them? So the next section, I'm going to break down discussions by age. And again, these are simply suggestions, because again, you know your child the best. You understand your child's temperament, your child's development. But these discussions are based on developmental theory and practice, and in understanding how children understand and process information. So for the youngest children, the point is to be very clear and honest. Make sure that they understand that if something changes, and ALS is now present and might affect activities of daily living or function, make sure that they understand that they did not do anything to make that happen. They're not at fault, and that it's not something that they can catch or is somehow contagious, because children in this young age are very concrete thinkers. They don't understand abstract thought and kind of hypotheticals. They see what they see and they know what they know. So if they see someone who's being ill and they've been around them, maybe they're going to be sick too. So you have to think about how you approach that and make it very clear. And you can talk about it in straightforward language that helps them understand that Daddy can't do this, but let's think about the other things that daddy can do. Let's normalize that situation so that they don't think that it's their fault or that they did anything to it. Next slide. Middle childhood can be a pretty complicated time to have these kinds of conversations because children in this age range are very focused on their identity and their identity development. And they're really thinking about other kids and what are other kids doing and how am I connecting with other kids. And so, what you might find is that children in this age range are thinking around, our family feels a little weird because we have this thing that maybe other families don't have. But what is nice about children in this age range is that you can start having more complex conversations and a little more detail. Continue to let them know that it's not a negative or a bad thing. And again, this isn't rooted in the fact that they think they're bad or you're bad for having it, but it's simply because they are looking to their peers and they're assuming that it's bad because their peers don't have it, which is also another reason why it's excellent to have as many peer engaged programs and supports as possible, particularly in this age range, so that children can come together and you can have like with like. Because as they're building that identity and identifying themselves by the peers around them, they're seeing other peers who are living in families with ALS. Next slide, please. Adolescence is where you can really go into more of the hypotheticals, right? You can talk more abstract, but you have to be very cognizant of the fact. And if anybody here on the call has an adolescent, they can be very distanced from their feelings. And it might seem like they're shut off. They don't want to be connected. They're trying to differentiate themselves from their family in a way that makes it seem like they don't care or they aren't necessarily interested, which is absolutely not true. But it might make conversation with them a little more difficult. So allowing them to do what they need to do, to be with their friends, to see their job or whatever it is, but make sure that that conversation is open. Continue to have the conversation. Your door is open. You're not pushing it. You're recognizing that they seem like they're shutting down, but that's so very developmentally appropriate. Let them come to you by always letting them know they can talk to you. And that's a real cornerstone of adolescent conversations, particularly tough adolescent conversations. Next slide. So what if your child doesn't want to talk about ALS? And I'm betting that some of you on the call or watching this later probably said, yeah, I've really had my child to say, I don't want to talk about this. I don't want to go there. So think about why your child might be saying that. And it might be that they're just processing and they're overwhelmed, and that's fine. Remind them they can come to you at any time. But I encourage you to think about how you feel about ALS. And the you can be someone who personally is living with ALS, or it can be someone who has a loved one with ALS. How do you feel about it? And if you're a little standoffish and unsure, or you don't want to talk about it, think about how that is modeling the communication you may not be having with your child. And it's very, very difficult. And I completely understand that. And this is a great opportunity for you to be able to go and get the support you need from the ALS Association or from whoever your trusted source is, so that you can be more open and engaging and your child can be comfortable to come to you. Next slide, please. So this is also really important. What if they ask you something and you think, I am not at all comfortable answering that? And this is probably going to happen if it hasn't already happened. So what would make you comfortable? What do you need to know about ALS? How do you need to feel about ALS? And it's perfectly fine to take the time to sit with it and say, I am really struggling with this, or I just need to get a little more information. Take that time, get those resources, and then come back to your child by showing them that you really do want to talk about it, but you're being honest in it's a hard conversation. And sometimes parents struggle with that because they don't want their children to worry about them, and so then they don't show the level of emotion that they might be feeling. And that is completely understandable and by no means to be judged. But if you can think about how you can sit with your own emotion and be comfortable and okay with showing emotion, then that will help your child feel comfortable to ask you those kinds of questions. And even if you don't have an answer, you can say, I don't have an answer, and we're just going to figure this out as we go along. Next slide, please. So, this is probably the biggest question I get. I don't want to talk to my child because I am protecting them. So, this is very much connected to all the things that we've talked about. So, if it's just because you don't know what to say, which makes perfect sense, go to your trusted source, go to your counselor, go to the association, ask folks, how can you have this conversation? Maybe you know your child really well and you know that they can't handle it, or you think they can't handle it. Please connect up with a trusted source, a counselor, someone at the school who knows your child well. Process with them and figure out the best way to start and have that conversation. But if you don't want them to know, this is a real strong point of caution for you. Because the truth is, the internet exists and kids are on the internet all the time. They've probably looked it up and probably know more in a lot of ways than maybe you know about ALS. And what they do know is that they've looked it up, they've got this information, but you're not telling them. And I have seen this happen in far too many families where there's some resentment that gets built up because the child and the youth, they know about it, their parents won't talk about it for whatever reason because the child doesn't know, and it builds that resentment and isolation. And the struggle that can be resulted in that really manifests in some complicated grief, meaning it's very difficult to get through the grief of that because the family never talked about it in an in-depth way to let the child process and to let the adult process. So the key is to communicate, as hard as it is to communicate. And that's really the primary piece there. Next slide. So for those of you who are on the call, and I know there's several of you from the Greater New York chapter, thinking about how do we engage families. And it has been so much fun working with all the different chapters because many folks have said, we never really used to think about the kids much because they never came to clinic, right? Because if they aren't in the clinic and they don't really come to the chapter, they exist and they're kind of out there somewhere floating around, but you've never really met them. I hope you take away from this the absolute opportunity you have to reach out to those families, to engage them, to say, who are the children in your family? We want to work with you. We want to build that trust. We want to be able to develop youth programming. So, just a tiny little plug for the chapters or the organizations on the call to really encourage you to reach out and kind of put your arms around the families and ask about the kids and what can you do to provide support and program for them. Next slide. So this is a topic that can probably be emotional for a lot of folks on the call. And it's because there's a lot of shame and stigma around the issue of relying on, engaging with your child or your youth to help take care of you. Next slide, please. So when we ask children about caregiving, we're talking about care that is provided by youth as young as 6. And it can be anything ranging from helping them get in and out of a chair, helping someone get dressed, helping to make food for them, helping to feed them. There's a variety of tasks that happen in caregiving. And when we ask children and youth, and I've interviewed now across disorders, many hundreds of youth, and they talk about it is challenging, but you feel a sense of positive and negative. And I put this here intentionally because I think a lot of people's immediate reactions are caregiving by a youth is somehow inherently bad. And the truth is that it's not, because they get a tremendous amount of positivity from it. But what we need to do, and I mean we, by our families, our professionals, we need to rally around the families and make sure that they have the support that they need so that the work being done by the children and the families isn't without support. So I think this is a really powerful quote in that they recognize that there is a lot of work that they're doing, that it's challenging, but there's this really interesting kind of caregiver piece with this child because they know that they have to put themselves aside a little bit to help out their family member. Next slide. So if you think that caregiving is bad, being provided by children and youth, what we know is that it's not inherently bad. But when there is no communication about it and there's no minimal support and there's little guidance, that can really result into some negative outcomes. And all of this issue of caregiving really is deeply connected with the earlier conversation about how do I even tell my child I have ALS? So if you're in a family where you're kind of struggling with how do we talk about it, and yet your child is doing things to help take care of you, but you're not really talking about it, it can be a very complicated situation. And the thing that you all need the most and deserve the most is support. But if you don't have it, next slide, please. What we see is that children can talk about feeling unappreciated, but parents, bless them, they feel like they're a failure because they rely on their child. And overall, the family feels scared that the child's going to be taken away because this is somehow a negative that the child's helping out. And then you have this like shame and stigma wrapping around the family. And all of these things don't disappear if the family talks about it, but they aren't felt as much if there is an immediate conversation and an engagement with trusted sources like the association to ask, what are some supports you can provide me and my family and my child? And that might be respite, that might be some assistive tools, that might be someone coming in the home to do an assessment. Maybe there's opportunity for some home health, whatever it is. The longer you don't reach out, the more these potential negatives can happen. And I've seen all of them play out in a variety of different ways. And what is so interesting is that the child is always really wanting to do something to help. And the parent is so absolutely beautifully grateful, but feels like a failure or a struggle for having their child help out. So it creates this complicated situation when there is so much opportunity for support and for help in the family. Next slide, please. So one thing families can do is let your child know that you appreciate them. And it sounds incredibly simple, but that you will love them whether they are helping, providing care, doing anything along those lines or not. And it is a very important thing to say, because if the child is equating your love to the care they're providing, then that can create a lot of anxiety in the child. So making it very, very clear. If they help you get up and out of a chair, if they help you with food, if they help you with other things, let them know that you appreciate it, whether they did it or not. And that you want to talk about how you feel about it so that they can talk about how they feel about it. And you're not hurting each other's feelings. One of a project that I did many years ago, we asked youth in families with Huntington's disease why they never talked to their family members about big issues around death and dying and end of life choices. And over and above, the children said they didn't want to hurt their family members' feelings. And the same is absolutely true from the parent to the child. So there's a lot of, I don't want to hurt their feelings. So that is a critical place for conversation so that we know we're not hurting each other's feelings and we're just expressing how we do feel. Next slide. So please do tell them how you feel. And it's interesting that families ask, well, am I allowed to be emotional? Like it feels weird to be emotional in front of my child. It feels uncomfortable that I say I feel awkward or I feel upset. And the truth is, anytime you open up and you're honest and emotional, you're modeling to your child how you hope or want them to respond to you. So you can say that, I feel bad that you helped me, but I am so very proud. And that's an actual quote from a parent who said that to their child. And that way, the child can feel comfortable, but they can also say, you know what, sometimes it's difficult. And this is another entree into conversation. And it can be a bigger conversation about ALS. It can be a more focused conversation about caregiving. Next slide, please. And they feel both negative and positive, and adults feel it and children feel it. We feel that it makes me feel better about myself, but it's also kind of sad and stressful. And I put this slide on here not to keep hammering this point home, but just to make it really, really clear that children and youth very much feel the same way about care and about ALS as the adults do. They feel the both, the positive and the negative. And once we kind of sit with that and realize it, then we can be honest about our feelings as well. Next slide. So supporting children and youth, and this is all part of the conversation. And what kids ask for is they want people to show them emotional support and give them emotional support. And this is all part of talking about ALS and illness. And they also want people to help them. They want people to give them guidance on how to do care tasks or just information about the disease itself. So when we ask the youth, what do you need and what do you want? They tell us explicitly. And these are themes that come up in every single study I've done, in all of the disorders that I've looked at. Children and youth say the same thing. They want to be told information about the disease. They typically want that information to come from their parent or family member. And they want to be emotionally supported. They want their family to be seen as worthy of emotional support. And they want their family of origin that they live with, whomever that family is, to support each other as well. Next slide. So how do we get that support? Straight up, friends and family, the ALS Association, your child's school, community organizations. If I've said it once, I've probably said it 50 times. Please, I encourage everybody on the call to reach out to as many people as possible. And I do know how difficult that is, that sometimes it feels like you're maybe airing your family's issues or you're asking for too much. But the truth is, there's always so many people who are out there with information, with resources, with support, who are willing and very interested and excited to provide support to you. Next slide. One of the most recent books that I've written is about schools. And this is, for a lot of families, a tough spot because kids are often going back to school. Maybe they're starting a new school, particularly now where everything is online and there's just so much disconnect. This guide is for school personnel. So if you're out there and you have a child in school and you'd like to be able to engage them more around what is ALS, how can they help the child, how can they be more supportive, please ask. These books are available through the ALS Association, and we'd be very happy to provide them to you. They're all based on not only my research, but interviews, and really give a solid guidance for school personnel and really helping to know how do I support this child? And particularly, how do I support this child through grief and loss? Next slide. So, youth programming are absolutely critical to the well-being of children and families. Like I said, they help develop peer support so that kids aren't alone. They see that there's another child just like them. They provide education about ALS. You can build a wider circle of supports. And children and youth have the opportunity to feel like a child and a youth. And it lets you, as the family member, give them that respite. And something that often comes out of youth programming and supports, two primary things. One, activity that helps them feel like they're making a difference. So these are programs that can result in advocacy, in, fundraising and awareness raising. Kids feel like they're giving back in a way that maybe they hadn't been able to before. Also, it helps them learn from other youth about what might come next. And what might come next is the death of a loved one. And this is where they can share with other peers opportunities and ideas for memory boxes, something that they can put together to help them either remember their family member and loved their family member and loved one, or something that their family member can create to give to them later on in life, to give to them that they can look at every day, once a year, whatever it is. That these youth programming have so many wonderful opportunities that wherever you are on the call, if you're listening to it in New York or wherever you are, I highly encourage you to engage with your local chapter of the ALS Association and see what they have in regards to youth programming. Next slide. And finally, these are the rest of the books that I have written, and they're really targeting kids and youth and young adults at different ages. The middle one is the youngest book, and that's a graphic novel for young children. The red book is for kind of that tween age, slightly awkward, wanting to identify with their peers. It's written in a way that is, what are other children doing? What would they do? And they're real stories and real examples. And then the last one is for young adults, which is a population that gets kind of lost in the mix because we think about kids like younger children, or we think about adults. But what about those like late teens, early 20s? And this is a book that is squarely focused on them. Again, it uses interviews and real case examples so that young adults can feel like, oh, okay, this is how I manage going to college and taking care of my parent. Next slide. So you might be surprised by what your child says when they're asked. So at the end of a whole string of interviews, I always ask the children, what would you say to a child like you, a youth like you, however old you are? What would you say to someone like you? And it is always the most powerful question I ask and the most powerful response I get. And what this particular youth is saying is that you have to be able to accept things. There's not a whole lot you can do about it, but you have to be able to move along and be patient and be aware and be really engaged in the moment. And this is such an adult thing that this 14-year-old individual talked about. So I think sometimes parents don't always give their youth kind of the credit for knowing more or being able to explain more. So I put this up here just as a support to say, you never know. Your child may surprise you by saying they've really thought about all of these issues. Next slide.
Hi, Melinda.
Yeah.
It's Peg. We just wanted to make sure before we end at 4:15, which we've got around 3 minutes left in this session. We do have one question that actually goes to the slide that you just had up with the resources of those books that you have made.
Yes.
An individual, a parent just wrote in that her father just recently passed away from ALS, and granddaughter is 4 years old. She was very close to him, also helped out with feedings. She knew that he was sick and that he was getting more sick, but we never said that he was dying. Are there any resources available for someone at that young of an age? So the child is around 4 years old. Would any of those resources be something that would work for that family and that child?
Yeah, actually, so it isn't written for children that young, but the graphic novel would be very helpful. You could walk her through it. It's written in kind of cartoon graphic novel. It's this middle one here. There is a whole section in there about the death of a loved one and what that feels like. So I would absolutely get the graphic novel and walk her through it. Yes. And I'm sorry, Meg, my apologies. I thought I had till 4:15.
That is perfectly fine. That one else has any questions, just place those in the chat box for us. Would you say there's any other resources that you might have if someone was around that age other than the graphic novel? Are there
Well,
any?
what can be very, very useful for children that age is play therapy and kind of walking through it in terms of acting things out, kind of creating things with their hands, drawing it out. Children that young don't necessarily have the verbal command to be able to explain their thoughts and feelings, but they would be able to either play them out or act them out. So think about in those terms that might be helpful for someone that young.
That is super helpful, Melinda.
Good.
Ellen, do you have any other questions that you think might be?
I'm actually Nathan, can you turn my video on? We actually have a question and answer box. If anybody has any questions they want to add, we are going to be out of time shortly, but we also have our website, ALS at als-ny.org, if you need your questions answered. We're more than happy to get them answered for you.
Can you go to my last slide so that folks you can just skip to the end. I think there's just one or two left so that folks can see my email if they needed to email me with any questions. Would that be possible to do that? There you go.
Great, yes. And thank you very much for presenting today. It was very, very helpful, very informative. I also learned some new things, which is great.
Wonderful.
And I hope it's helpful, and everybody on the Zoom is appreciated Dr. Kavanaugh, and we thank you so much for coming.
I am so very grateful. Thank you so much, everybody. Please do feel free if you want to shoot me an email. I'm happy to answer. Take care.
Thank you.